Hello friends, so our today's topic is developmental disturbances of teeth. So first is disturbances in shape. So first we will discuss what are the disturbances in the shape of the tooth. First is microdontia. As you can see in this picture, this lateral incisor is smaller in shape as compared to the central and canine. So microdontia is a condition the tooth is smaller in size or smaller in shape. Maxillary lateral incisor is the most commonly involved. It can be categorized into true generalized microdontia and relative microdontia. True generalized is when the shape of the tooth is smaller than the other teeth, whereas the relative generalized microdontia is where the jaw is larger and the tooth seems to be smaller. So this is the relative microdontia. The most commonly tooth involved is lateral incisor and third molar. True generalized microdontia is common in Down syndrome. Then coming to the macrodontia, as you can see in this picture, in this the tooth is larger in shape as compared to the other teeth. It can also be classified into localized and generalized. Localized when there is only one tooth involved, and generalized when all the teeth are larger in size. So the most commonly condition is pituitary gigantism. It is also known as megadontia. Now coming to the third, taurodontism. Taurodontism is a condition in which there is failure of cusp invagination of Hertwig epithelial root sheath, and there is apical displacement of pulp horn. As you can see in this picture, the pulp is apically displaced with short root. So the tauro means the bull and dontis means the tooth. So here the tooth appears to be in the bull shape appearance. Here the tooth will be rectangular in appearance. So it can be of three types: hypotaurodontism, mesotaurodontism and hypertaurodontism. Hypo is the mild form where there is slight apical displacement of the pulpal floor. Meso is the moderate form where there is apical displacement of the pulpal floor at the midline of the root, and the hypertaurodontism is the severe form where there is apical displacement of pulpal floor near the apex of the root. So we will take the radiograph to check whether the tooth is larger in size or not. The prevalence rate is 2.5 to 11.5%, and the clinical implication is there is a chance of pulp exposure during restoration. Now coming to the fourth condition, that is short root. It is given by Lind. There is reduced crown to root ratio and it is a autosomal dominant pattern, and here the maxillary incisors are most commonly involved, and after that the premolar is involved. The prevalence rate is 2.4 to 2.7%. Mongolian are most commonly affected, and here the gene involved is matrix metalloproteinase 9, and the clinical implication is since the root is short, so there will be early tooth loss. So these all are the disturbance in shape: microdontia, macrodontia, taurodontism and the short root. Now coming to the disturbances in the tooth number, the first condition is hypodontia. Hypodontia is when there is less than and equal to 6 teeth missing. So the number of teeth will be missing will be less than 6, excluding third molar. This is the important point, that excluding third molar there should be less than 6 teeth absent, and it is most occur in female, and in primary dentition the prevalence is less than 1%, and most commonly tooth involved is mandibular second premolar and lateral incisor, and it is most common in Down syndrome, Perry-Robin syndrome, and the gene involved is PAX9 and MSX1. So coming to the second condition, that is hyperdontia. As you can see in this picture, the tooth are more in number, and here the prevalence rate is 2%. As you can see here, the number of tooth are more. Now coming to the third condition, that is oligodontia. Oligodontia is a condition Oligodontia is a condition in which there is more number of missing teeth and it is more than 6. It is most commonly in ectodermal dysplasia, Down syndrome and Klinefelter syndrome. So the difference between hypodontia and oligodontia is here the tooth missing is less than 6, whereas in oligodontia it is more than 6. Now coming to the fourth condition, that is anodontia. Anodontia is a condition where there is complete missing of teeth and complete absence of teeth, and it is most common in Rieger syndrome, Kabisky syndrome, etc. Next, the condition is mesiodens. Mesiodens is the extra number of tooth, also known as supernumerary tooth, and it is known as supplemental, and it is of 4 type: conical, tuberculate, supplemental, odontome. If you want a separate seminar on mesiodens, I will provide a separate seminar or lecture. Comment down in the comment box whether you want it or not. It is most common in craniofacial syndrome and cleft lip and palate. So these are the disturbance in the number: hypodontia, hyperdontia, oligodontia, anodontia and mesiodens. Now coming to the disturbance in the position, as you can see the tooth will be in different position. First is ankylosis. Normally the primary tooth that will be fused to the root. There will be fusion of the root to the tooth bone, and it is because of the trauma, and the prevalence rate is 8 to 14%. Most commonly tooth involved is primary mandibular second molar. Here the tooth will be infraoccluded and it is also known as submerged tooth. And second is ectopic eruption. As you can see here, the canine is not erupted in its actual position and it is erupted in buccally here, as you can see, and there will be delayed eruption, and in future orthodontic treatment will be needed. Then third is the impacted tooth. Here the tooth will not completely erupt and it will blocked out in the bone because of the difference in angulation or because of the impaction. The most commonly tooth involved is third molar, which is 16 to 68% impacted. After that canine is impacted, where the prevalence rate is 0.2 to 2.4%. So the most commonly tooth impacted is third molar. After that canine is impacted. For impaction, surgical treatment is required. Then fourth is the distally displaced premolar. As you can see, the premolar has displaced distally and it is displaced near the last molar. This also shows the delayed eruption of the tooth. Now coming to the anomalies of the infancy, the first will be natal and neonatal tooth. This I have already explained in my previous videos. You can go back to my channel and see the previous videos of natal and neonatal teeth. Second is the fusion. It is the most common in the primary dentition. Here you can see the two teeth are fused. Here the two different developing germs are fused together. It can be complete and incomplete, and here you can see there will be developmental groove formation where the caries most commonly occur, and it is most common in primary mandibular incisor. Third is the gemination, where there is incomplete division of the tooth germ. The difference between the fusion and gemination is, in fusion there is fusion of two separate individual tooth germ, whereas in case of gemination there is incomplete division of a single tooth germ into a two tooth. And fourth is concrescence. Here the tooth is joined by cementum, as you can see in this picture. Here in this radiograph, the tooth is joined with the help of cementum. There is only fusion of root. Coming to the other anomalies left, first is dens invaginatus. This is dens invaginatus, in which there is invagination, Hertwig epithelial root sheath, and there is a formation of tooth inside a tooth. So this is most common in lateral incisor cases. It can be of two types, coronal and radicular. Here the appearance of tooth is tooth within a tooth. The second is the dens evaginatus. Here there is a formation of small cusp over the tooth and there will be evagination of the tooth tissue. Then the third is the hypercementosis, where there is non-neoplastic deposition of cementum in the root, and it is most commonly in mandibular molar. And the clinical implication is these tooth are very difficult to extract because of the bulky root. Then coming to the talon cusp, it is a eagle-like cusp, most commonly in the maxillary anterior, and this is like a tail-like or a extra cusp on the maxillary anterior palatal surface. If it is interfering with the occlusion, we should remove it. And next is the dilaceration. It is the sudden bending of the root at any angle. It is the bending of root in a particular direction or a particular angle. This is most commonly because of the trauma, and most commonly tooth involved is mandibular third molar. So these are the other anomalies or the developmental disturbances. Then coming to the disturbance in the structure of tooth, the tooth can be disturbed structure wise. First, in this picture, as you can see, this is amelogenesis imperfecta. There is developmental disturbances in formation of enamel, and it is a autosomal dominant disorder. Then second is the dentinogenesis imperfecta, where there is normal deposition of the enamel but the dentinal deposition is disturbed. Here the tooth appears to be yellowish in color and very fragile and weak. Then third is the dentine dysplasia, where there is abnormal dentine deposition and the enamel deposit is normal but the dentine is atypical. It is a autosomal dominant pattern. Then fourth is the regional odontodysplasia. This is also known as goose teeth, because as you can see in the radiograph, this appears to be in ghost in appearance. There is no well formed structure, and there is atypical deposition of the dentine. If you want a separate lecture on structure of tooth, I can explain it in the detail. So these all were the disturbances in the structure of tooth. Thank you.